Good afternoon, this is Brittany Leonard, and I'm here to discuss with you the subject of fibromyalgia. Fibromyalgia is a syndrome that affects an array of systems in the body, and today I would like to discuss those systems with you, as well as how they are affected, and how we as physical therapist assistants can help those patients to improve and manage the lifestyle that they have. But before we get started, I have a video that may kind of give you an idea of what they're facing. Take a look.
I'm not touching you. What do you mean? She's touching me. I'm not touching you. Not touching. Touching me. It's free air.
Okay, so obviously that was not a real fibromyalgia patient, nor was that a real clinician. But I want to give you an idea as to how sensitive fibromyalgia patients are. Fibromyalgia patients are characterized by tender points or trigger points that are all over their body, and they're very sensitive. They're heightened, actually. Their perception of pain has been heightened, and so barely touching them, as Leo was doing to Stitch, it aggravates them and it hurts them very bad. They can't take a lot of pain and pressure. So at the very end, where Leo was almost touching or actually touching Stitch, that would have hurt a fibromyalgia patient. And obviously, they won't lick your face as they did in the video, but it will hurt them very badly. So how is fibromyalgia diagnosed? Presently, a dulometer is used to test the 18 tender spots that most fibromyalgia patients have. If 11 of those 18 spots are tested positive, then they are diagnosed with fibromyalgia. They must also, however, complain of widespread pain above and below the waist for at least 3 months. Here's a picture of some of those spots that most patients complain of. Really, it's all 18, I believe, and so you can kind of take a look at that. So how does fibromyalgia affect the patient? It affects the hypothalamic pituitary adrenal axis, or HPA, the autonomic nervous system, the reproductive hormone system, and the immune system. Starting with HPA, we know that this system controls the perception of stressors, and we know that pain is a stressor on the body. And we know that pain starts with a signal, whether it's the signal that we gain from touching a hot stove or picking up an ice cube. It starts with a signal. And so when the signal is pain, we know that it is transferred to the brain via substance P. Well, in patients that have fibromyalgia, substance P is increased drastically. Thus, they have a heightened perception of pain. And so any type of pressure, any type of painful signal that they gain is almost 10 times higher in their body, and they perceive it as 10 times higher than we do in our bodies. The autonomic nervous system is also affected in patients with fibromyalgia. We know that this system serves as an umbrella for the sympathetic and the parasympathetic systems, and all of those systems are imbalanced with these patients. The neurotransmitters are imbalanced, and thus causes the overall system to be imbalanced. One particular neurotransmitter that is imbalanced is serotonin, which affects our ability to sleep and the depth of sleep that we encounter. Fibromyalgia patients do not enter in what is termed as REM sleep, or rapid eye movement sleep, and during this time our muscles repair, we gain stimulation of the growth hormone, and because they do not encounter this sleep cycle, this part of the sleep cycle at all, their muscles never rest. And so, as we talked about, they're in a great amount of pain, and because their muscles never rest, they're in a constant state of tone, and so thus it causes them to have more pain. Our last bullet point says that this syndrome is often misdiagnosed, and it's often misdiagnosed because they do have a great amount of sleep disturbance, and thus they're most often fatigued. And so fibromyalgia is typically misdiagnosed as CFS, or chronic fatigue syndrome. Fibromyalgia also affects the reproductive hormone system. It is impacted by stress, and it causes a decrease in the reproductive capabilities, as well as an increase in sleep disturbances, particularly in women. The last system that we will discuss is the immune system. It also contributes to an increase in substance P. It is believed that through the ganglion cells that are transmitted during viruses and infections, that this system increases substance P through the increase of pro-inflammatory cytokines. And this process, as we talked about with the HPA, causes an increase in substance P. Thus, they have a higher perception of pain. And so if you see my little picture there, the guy that's sick, he has a virus or some type of infection, that equals an increase in pain for them because their pro-inflammatory cytokines have been increased. So who is at risk? Research has shown that women are more at risk than men, that this particular syndrome affects women 90% of the time, particularly between the ages of 20 and 55. The lifestyle of these women normally consists of anxiety, depression, sleep disorders, as well as infection. And that should make sense to you considering our previous slides and the different systems of the body that were affected. The anxiety and the depression act as stressors that affect both the autonomic nervous system as well as the hypothalamic pituitary adrenal axis, and the sleep disorder also goes under the autonomic nervous system. The infections go under the immune system, and so that should all make sense to you. So is physical therapy indicated? How can we as physical therapist assistants help? Physical therapy is highly suggested and significantly indicated. Due to the sensitivities, however, physical therapists and physical therapist assistants must remain aware of their patient's tolerance. We must remember that they are very sensitive, and so we have to remember that to progress them slowly. Anything that goes fast or anything that will increase the inflammatory response, such as ultrasound and such as hot packs, are contraindicated. Things that are indicated, modalities that are indicated: electrical stimulation, massage for relaxation, therapeutic exercise, and especially hydrotherapy, because it allows for the unweighting of the patient, and it also keeps them motivated that they can continue through physical therapy even though they're in pain. The Nagy model is used in physical therapy to address diseases and syndromes in a way that begins with the pathology and ends with the disability. And so we've talked a lot about the pathology of fibromyalgia in that it affects a number of systems which sometimes affect each other, which can cause a breakdown in the patient's body. But I kind of want to touch on these last three, the impairment, the functional limitations, as well as the disabilities, because it's important that we as physical therapist assistants understand this so that we can properly encourage as well as enhance our patients. The impairments of a patient that has fibromyalgia can consist of, but of course are not limited to, the heightened response to pain, joint immobilization, probably due to pain as well as stress. And if these are not addressed, they can become functional limitations, which include decreased ability to balance, decreased ability to transfer themselves, and of course if those are not addressed in a proper timing or in the right way, they can progress as well to a disability to where they are completely unable to independently manage their lives. And so physical therapy should, and I believe that it is, a valued element of the process to wellness for fibromyalgia patients. So what is the prognosis and lifestyle alterations that need to be made for the fibromyalgia patient? The prognosis for a fibromyalgia patient is excellent, especially with physical therapy. Of course, we have to be mindful, as we talked about before, but if we are mindful, it's excellent. Now, the lifestyle alterations on the side of the patient, they must be mindful of their diet. Now, we didn't talk much about this under the autonomic nervous system, but under the autonomic nervous system, the digestive system is affected. And so it affects the level of nutrients that they receive. It affects the transmission of those nutrients. And so they need a diet that's high in nutrition in order to maintain and to help their prognosis. They also need to decrease stress in their life, and they need to maintain the strengthening and stretching exercises that are indicated within physical therapy. So in conclusion, it is important for us to remain aware of the research that goes on with fibromyalgia. Make sure that we become aware when there is a potential cause, a definite cause for fibromyalgia, and the contraindications and how they may progress, so that we can properly treat our patients. Remember that we do function through evidence-based practice, so it's important for us to gain this knowledge. Let's remain aware so that we may accurately and properly enhance the well-being of each patient regardless of the diagnosis. Thank you for your time.